Hi guys, Aaron from my physio SA at the North Adelaide practice. Welcome to another one of our instructional videos. We're going to have a look at low back assessment today and some of the things that physios can do to help you if you're having pain. Okay, so if you come in with low back pain, the first thing we'll do is have a quick look at your movement. Okay, so Mel's going to show us the movement. So the first one we're going to do is just bending forward like you're going to touch your toes as far as you can go. Good, and coming up. So have a look. Does that reproduce their pain? The next one we're going to do is hands on hips, and we're going to have a look at you going backwards. Cool. So we're having a look at lumbar extension there. And if you face this way. So now we're going to have a look at lateral flexion, so side bending. So stand with your feet apart a little bit. Okay, and just bending down to the side as far as you comfortably can. Good, and over the other way. Good, okay, so that's lateral flexion. And then if you ever sit on the bed facing this way, and just get them to sit up nice and tall, and then we're just going to cross your arms, and we're going to have a look at your rotation. Okay, so if we've identified some restrictions there, we might have a feel of how the back is. So if you have a lie down on your belly, and we'll just have a feel of the joints and see what we can do. Okay, so what we'll do is have a feel of each joint along the side, and then we're going to compare it to the other side. Okay, so we might find some stiffness at one or more of those levels. Okay, and it often corresponds to where the person's actually feeling sore. Okay, so we can find those areas of stiffness. The other thing that we might do is just have a feel of the muscle tension around here and see if you release and try and relax those muscles, because they often tighten up when someone's got a sore back. Okay, so that's one of the treatment techniques we do. Another one that we'll do quite often is a immobilisation. So if we find some stiff areas, we're actually going to do some gentle movement at that level. Okay, so that's just trying to help those joints move a bit more freely. Okay. The other thing that we'll do, if you just lie on your back, Mel, for us. The other thing that we do when we assess someone is we have a look at their neural mobility, so how the nerves are moving. Okay, so just a couple of movements. So the first one's going to be a straight leg raise, so I just move that until I feel some resistance, and then I ask Mel about the back pain. Okay, so we're going to obviously compare that to both sides. Okay, in this position, if you just bend your knees up so your feet are on the bed. Okay, the other thing that we'll do is have a look at someone's core activation, so those deep tummy muscles that hold your spine in position. Okay, and what we're going to do is have a look in this position. Is we'll put our fingers on the muscle, and we'll get Mel to try and do a deep tummy contraction. Okay, yeah, and she's activating quite well there. So in back pain, sometimes people's core muscles don't work as well, so we need to do some retraining. So we can use an ultrasound machine to show people if they're working or not. Okay, so that's